Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Bacillus cereus. Bacillus cereus outbreaks are usually due to the poor reheating of previously cooked food, for example, rice, and this is the scenario that you're most likely to encounter in an MCQ exam in your MRCP. The bacteria is found in soil, food, dust and vegetation, and the infection is actually quite common globally but is underreported due to the self-limiting nature of the disease. So Bacillus cereus is a gram-positive, rod-shaped, spore-fawning bacteria. Spores are resistant to adverse conditions, so the bacteria are quite resilient. It forms two forms of toxin. So firstly, there is emetic toxin, which is also known as cerulide, and this causes nausea, vomiting, and a feeling of generally feeling unwell and abdominal cramps, and this usually takes place within 1 to 6 hours of ingesting the contaminated food. There are several forms of diarrheal toxins, so this group includes hemolysin BL, non-hemolytic enterotoxin or NHE, and cytotoxin K. These can actually be inactivated through cooking, unlike emetic toxin. Clinical manifestations of Bacillus cereus involve nausea, vomiting, abdominal cramps, as we've previously mentioned, and you may also have a diarrheal syndrome, which comprises watery diarrhea and abdominal pain. Symptoms usually resolve within 24 hours, although severe cases can cause dehydration. Management is very much dependent on supportive management, including hydration and electrolytes. This is very much a clinical diagnosis based on symptoms and dietary history, and if necessary, one can isolate the bacteria from the offending food. Antibiotics are not typically required for this condition. So let's try a question. What is the most appropriate initial management for a patient presenting with mild symptoms of Bacillus cereus food poisoning? So our options are antibiotic therapy, supportive care, antitoxin administration, surgical intervention, or antiviral medication. So the answer in this case is supportive care, usually with hydration and electrolyte therapy. This condition does not usually require antibiotics. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.